Perfect. Well, welcome. Happy Friday, Compensation and Benefits Action Group here. Happy New Year. We are so excited you're here with us. We have some great information to share with you today. And if the participation remains low, that's okay. We know lots of folks like to watch the recordings of this, so we'll go ahead and make sure that's available. And so that'll take us right into our housekeeping, which is our first reminder that we will be recording. Just to avoid sharing protected health information, just know that the recording will likely be posted to our website. So folks who weren't able to join us in real time can go back and watch it. So just be mindful and cognizant of the things you're asking and putting in chat, just knowing that it'll probably go out to the masses at some point. Use the chat. We have lots of folks here helping me manage the chat. And so you're welcome to ask questions, put thoughts in there, use that as you see fit. We will be posting the slides after the meeting as well. I typically send those out to that calendar invite of folks that are signed up. But where this is a group presentation, we may actually be posting it to the website as well, just so folks can access it because we know this is such good information for this time of year as well. So we will be providing the slides. If you're listening by phone, I'm not sure there's anybody here, but just in case, if you're listening by phone, welcome. Thanks for being here. You can press *6 to unmute your line or *9 to raise your hand. I have turned on closed captioning, which you can also turn on or off on your black Zoom toolbar, typically at the bottom of your screen. And for this information, as well as upcoming Direct Care Workforce Collaborative meeting information, you are welcome to check out our website, which I will drop in the chat. Right now. There's also our email address if you have questions or concerns or you're not able to find the recording from today. You can always follow up with us there and we can make sure to get you connected. So with that, if this is your first meeting, we like to just do a quick little level set. So first of all, welcome. Happy you're here. Happy you found us. We'll probably have a poll question here in a minute to find out how you found us. But this is one of the action groups of the Direct Care Workforce Collaborative. And so if you've been with us for a little while, you know that our collaborative is quarterly. Typically a lot of information dissemination in that meeting where we just bring a lot of updates to you and push out a bunch of information for an hour and a half. But then these action groups allow us to get a little bit more specific, a little more action oriented, bringing specific information around the topics, which is training and career advancement, compensation and benefits, and value and awareness for direct care workers. And so that just kind of gives you an idea of how these groups work and these stakeholder groups. Again, the action groups are really intended to reinforce the work of the Direct Care Workforce Collaborative or the information we're providing in that, and then we can really get a little more specific in these action groups. You'll be tasked with identifying problems, determining solutions, and developing and executing an action plan. For this group specifically, we've really worked on providing what we like to call a provider or direct care worker toolkit. So we're really looking at options that are already available to workers and providers. I think of Colorado Secure Savings, Connect for Health Colorado, Get Ahead Colorado today, really just trying to let you know what's available in this space to help you kind of supplement whether you're an employer or provider, or if you're a worker and you're just trying to find your way around all these resources. So that's kind of what this group has really been identifying as a way to move forward. Stakeholder voice is paramount. We love to hear from you. We love your questions. We love your feedback. Keep it coming. And I would just like to take a minute to recognize our co-chairs if they have joined us. It doesn't look like Ashley or Britt, either one are here. If you've been with us for a while, you know Ashley Weber. Ashley is an advocate and also a self-identified member. And so she comes to us with almost 2 years experience now of being a co-chair here. If I see her pop on, I'll certainly let her say hello. She's been a great asset and we really appreciate her. And then we have a new co-chair. Her name is Britt. Brittany Chavez. She actually works in human resources at a provider in Denver. And so we're really happy to have her on. If you've been around these groups, you've seen her. She actually co-chaired for us for training and career advancement for a stint, and then went back to school, had to leave us, but now she's done. So she is joining us again. So we're so excited to have her. And like I said, I will let them say hello as they pop on and join us. So just a quick overview of our agenda. I'm in the welcome and attendance right now. We will have a presentation from Isabel and Get Ahead Colorado. We'll have time for an open forum, which will just allow for announcements, networking, anything that we see fit. So the floor will be yours for 10 minutes, but if it's crickets, I won't keep you that whole time and I'll let you get out of here just a bit early. We will share some resources in closing and talk about some upcoming dates that are important. So with that, I know we just have a few folks here, but I'd love to just do some quick attendance. just instead of going around the room, we'll just do kind of a roll call in the chat. So if you just want to put your name and your agency or your role in the chat, and perhaps instead of taking time to do the poll questions, I think maybe I'll just have you put your county as well. So maybe we'll just take a minute so that all kind of introduce ourselves and see where we're joining from today, versus doing some polls. Awesome. Thank you guys so much. This is great. All right. So as folks kind of just trickle in there, see if notice anybody, if you have any people do some networking, whatever you do. But yeah, we'll just let folks kind of continue to introduce themselves and say hello. And I will go ahead and take us forward, take us back actually, because it looks like I'll be handing it over to Isabel here to get us going into her presentation. Isabel, let me stop sharing and have you introduce yourself.
Great. Hi, everyone. First of all, can everyone see that title slide there?
Yes, looks good.
Awesome. Great. Thanks for the introduction, Brooke. I'm thrilled to be here. Thanks for being here on a Friday to talk about tax. I hope that after this presentation, you will be just as excited about some of the credits that are coming online as I am, because they deliver valuable resources to people, care workers, and the families that they serve. So I'm going to jump in. Today, I'm going to cover some baseline information about tax credits very quickly. Some of the slides are kind of text heavy, but I'm not going to spend long on them. They're really more for reference later if you want to go back and remember some of the details. But one important thing is that you don't have to remember any details to connect to tax filing and tax credits yourself, or to help the families that you serve do that. That's not needed to remember the tax code in any way, but the rules are, they're complicated, but there are some amazing benefits that can get delivered to people this year. So we'll talk about why they matter, and what are some resources to connect to for free tax filing or to connect your families to. And, some people are very aware and knowledgeable about how tax credits work and tax filing, and others aren't. So that's why we'll have a little bit of baseline information today. First, why should those of us who support families be interested in getting people to file their taxes? It feels a little removed. I'm from public health, and I do get the question often of why is public health mixed up in this? Well, it can be a lot of money, flexible money that families can spend how they choose. And we also know that poverty is a root cause of poor and inequitable health outcomes. Here you can see some of the health and educational impact of tax credits that the research shows us. And I won't read all of this, but infant mortality and low birth weight goes down, child and household poverty goes down, reduced involvement with the child welfare system and increased food security, and then increased educational and earnings outcomes across the life course and even across generations. And a lot of people just aren't aware that they're eligible, usually because they make too little money to owe tax. They're not required to file taxes, so they don't. Who wants to do that if you don't have to? And miss out on these resources that they may be eligible for. We saw with the expanded federal child tax credit that lifted 40% of children who were living in poverty out of poverty temporarily. Food insufficiency went down, and most families, according to the Census Bureau, we have some good data on this, most families spent their credit on food, childcare, and school-related expenses. On this slide, you can see how tax credits stack up in reducing poverty, just right behind Social Security. And those of us who serve families are used to referring to things like SNAP and WIC and child care assistance. And we can also refer to tax filing in that same conversation so that people don't leave this money on the table. And we'll talk a little bit more about how to do that without getting into any complicated tax conversations a little bit later. So we have certain populations of focus, people who tend to miss out on these resources at higher rates. And we know that about 1 in 5 of those eligible for the earned income tax credit don't claim it. They leave it on the table, and it can be up to $7,830. Some of the populations that file at lower rates are people living on a low income, which I just talked about. New parents often aren't aware that they're eligible for the child tax credit. Caregivers and grandparent caregivers, if a child lives with someone for 6 months or more in a year, they may be eligible for the child tax credit. And then our newcomer communities often aren't aware that they can claim some credits with an individual tax ID number instead of a social security number. And I'll talk more about that in a moment. People who do not speak English and people in rural areas tend to miss out at higher rates. And care workers are really uniquely positioned to reach these families and individuals and help them know that they might be eligible for these resources. So what is a tax credit? It's just a decrease in how much tax you owe. So there's all kinds of credits. There's EV credits and I don't know, all kinds of stuff that we don't think about much in healthcare, but refundable supportive tax credits for families means that your tax burden is reduced, but the money comes back to you as a check or direct deposit if it's refundable and you don't owe more than that. But to receive the credits, you do have to file a tax return, state and federal, because there's federal and state tax credits. So if you don't have a social security number or aren't eligible to get one, you can claim some credits with something called an individual tax ID number or ITIN number. And that is a tax processing number. You can get that by filling out a form called the W-7. I mean, this is kind of in the weeds a little bit, but it's basically you fill out a special form and turn it in with your federal tax return. And volunteer tax assistance sites, VITA sites, can help with that process. There's a new credit this year, super exciting. It is called the Family Affordability Tax Credit. We have such a special focus on this credit this year. This is a little text heavy, don't need to remember any of this, but just to show you the amounts here can really add up. So it's up to $3,200 per eligible child, 5 years or younger, and up to $2,400 for children between 6 and 16 years of age. And this depends on income. So as income goes down, the credit goes up to a maximum of $3,200 per child, depending on income and age of the child. And so that's a new credit this year, and it's going to be added on to the other ones that also are out there, like the child tax credit and the earned income tax credit. And it's really going to be impactful. And I won't spend long on this, but these are just some of the other credits that are available along with that family affordability credit, things like the earned income tax credit, federal and state. You can see the amounts are pretty high. And the child tax credit, which is a $2,000 credit. You can get it refundable up to $1,700 depending on your income. And then there's a state match on that as well. There's also other credits that aren't even in this presentation, like educational expenses, childcare expenses. There's a special credit for credentialed early childhood educators that's up to $1,600. So lots of credits out there, but you don't have to worry about every single one of them because starting the tax filing process will get everyone their credits once they go through that process. So how do we talk about tax credits to families? It's really simple. Just, did you file? Are you planning to file? Have you filed in the past? And if they say yes, you can just move on. And if no, connect them to some simple free tax filing resources where they can learn more about their individual tax situation. I'm going to talk about some of those resources. 211 is always an option to refer people to because those operators are trained in the impact of tax credits and how to connect people to free tax filing appointments or free tax filing software. One resource is the Get Ahead Colorado website. This is a place where people can get connected to 3 free ways to file. This is just what it looks like, and it's mobile friendly. So there's free tax software there for doing it yourself. It's called My Free Taxes. It comes to us from the United Way International. If you've seen ads on TV for Tax Slayer, it's the same software as TaxSlayer. It literally connects you to free TaxSlayer software. There's an income limit there. You know, we are bombarded by these ads for TurboTax and everything. This is the same and just as good. It just leads you through screens of how to file your taxes. There's also some options for in-person appointments on that website. I'll come to that in a second. We have a new resource this year called the Tax Credit Calculator, developed with Gary Community Ventures. We're excited about this. I'm not sure if you can do some, put in some links for me, Brooke. I'm not the greatest at doing that in live time on Zoom.
Yeah,
okay.
I'll start dropping some stuff. You bet.
Okay, because this is Get Ahead Colorado, file your taxes. This, well, actually, I guess I can do it. That didn't do it, did it? So the file your taxes link at the top of that Get Ahead Colorado link will show you the calculator. It's brand new. It's kind of in test. It literally went, thank you, Brooke. It literally went live this week. So I think you know, we'll tweak it and hopefully make it a little bit easier to use. But basically, you just put in your income, your number of dependents and their ages, and it gives you a number of what you might be eligible for in tax credits. And it's just looking at earned income tax credit, federal and state, child tax credit, federal and state, and the new family affordability credit. It doesn't even consider all the other credits we just talked about. So that's a way to just get a quick estimate of what you might be eligible for. Of course, if you owe tax, that amount would go down, and it is very individual for each person. So I mentioned in-person free tax help. That's volunteer income tax assistance, or VITA. There's also, and that's a whole network of these sites around the state. There is also a network called AARP Tax Aid, free tax filing sites, and those that network is also, you can access the list of sites and map of sites on the Get Ahead website. VITA is free. There's an income limit, but they often don't turn people away unless their tax situation is pretty complicated. And those folks, you know, if you own a business or something, should probably be with a tax accountant anyway. And it's high quality. I just can't stress that enough. It's higher accuracy rate than paid preparers like H&R Block. So we know too that these volunteers are very dedicated and they're trained by the IRS, and the tax returns they prepare are then checked by another trained IRS tax preparer to make sure it's accurate before the person signs off on it. You can find a map of these sites, which again is being populated for 2025 right now, because those sites most of them aren't quite open yet. The IRS opens on the 27th of this month. So that map is kind of getting updated as we speak, but it's a pretty good representation of what's out there. And you can zoom in on the individual sites and see what hours they have, what languages are spoken, and start the process to get an appointment. For sharing information with the programs you might work in or others in your community, there is a bilingual partner toolkit on the Get Ahead website. This is what some of the materials look like: flyers, social media, there's email content. You can just drop in information without having to make it up yourself, and all kinds of resources there for people who work directly with families and want support in spreading the word. And then new this year, we have a coloring page. So this we're trying out in libraries for story hours and early childhood settings like UPK this year. And so it's got a coloring page on one side and tax information on the other. And the hope is that families might take it home and flip it over and get a little more information. There's also some very detailed one-pagers. They're being updated and posted now, but some of them are there. These are things like, what is an ITIN and how to get one? What are the steps to file? What documents do you need? And these can support your conversations with families about those kind of sticky questions. But again, you can also say, I'm not a tax expert. Just look into it and get in touch with a tax professional if you don't want to get into these types of details. And I'm sorry this says libraries. I meant to change this, but this is just kind of how some programs engage, like hanging a flyer or training staff in a program on talking a little bit about taxes as they talk with their families, things like that. People have common concerns about engaging with the tax system if they haven't before. And you can reassure people if you kind of can anticipate those questions. So sometimes people worry that a tax refund might impact their existing benefits because it might push them over the income limit, but it does not, because tax credits are not counted as taxable income. So they do not push people off the so-called benefits cliff. Some credits, you need very minimal earnings to claim them. And some credits, as I said, you can claim using an ITIN number if the children have a social security number. And concerns about fraud, you can recommend that people use like a trusted source for their tax filing. There are some kind of bad actors out there for tax preparation. So it's important to make sure that the person is certified by the IRS and is trusted. So the care worker tax credit, this is very exciting. This is a new law that passed. It does not go into effect until tax season 2026 for this tax year, 2025. I want to let you know this is new to everyone and us, and we're still trying to grasp how it's going to work and what the rules will be for care workers and how HCPF will handle that. So right now, we know that it's probably a good idea to track your hours if you're not already for 2025 to make sure that you have those available when it's time to claim. There's income limits, and those are on the slide there. HCPF will likely provide guidance. I'm not an expert on HCPF's processes, but they'll likely provide guidance as the Department of Early Childhood has done this year for their family, friend, and neighbor caregivers. So it will likely be a system of registering with HCPF, so that can be provided to the Department of Revenue to verify that the person is a care worker and can be eligible for this credit. And the information we have is pretty much just from the bill, and the link is there if you want to learn more. It can be up to $1,200 for people who care for children or are care workers, depending on eligibility. So a little bit of uncertainty there, but very exciting new development for tax credits. We do have a partner webinar coming up next Wednesday. All are welcome to attend. You want to hear this information in a little more detail, as well as some partner speakers will talk from the Department of Revenue just to get us excited about the tax season and share more detailed information. That's from noon to 1 next Wednesday. Anyone who's kind of tax curious about how to connect families. So it's really for programs who work directly with families to know what some of the opportunities are and how to quickly connect people to the information. So all are welcome to that, and the registration link is there. These are just some quick links to services that help people who might have more complicated situations. Maybe they haven't paid in a while and they don't know what to do. There's things like low-income taxpayer clinics or advocate service that can help with those more complicated situations. So that is all my info. My contact info is there, and you're welcome to reach out. I'm happy to answer any questions that you might have. Thank you so much.
Thank you, Isabel. I didn't see anything come in the chat, but we'll just give folks a minute here to ask any questions they might have. And I did put the link in there for the upcoming webinar on the 22nd as well. So that'll be a great opportunity. And we're also going to welcome them back to the larger collaborative as well in March to reach that larger audience. But just know that you'll have another chance to ask questions and engage as things pop up. All right. Well, perfect, Isabel. We won't keep you any longer. I encourage folks to reach out if you have questions. If you need help getting in touch with her, we can certainly let you know. And we'll make sure we provide these slides as well with all the information and the clickable links as well. So
sounds good. Thank you so much, everyone. I hope everyone has a fantastic weekend.
Awesome. Thank you so much. All right. Let me get us back up here. So we're a little bit ahead of schedule, which is fine. It's a Friday. We like that. And so we do just want to take a few minutes for an open forum. This is a chance for you to share any announcements you might have happening in your space, webinars, resources you found. If you have any questions in the space that we might be able to answer or some of our colleagues can answer, we'll certainly take those as well, thoughts and remarks. So I'll just open the floor for a minute here to share. And I actually think we'll always talk. HickPuff will always talk. So I do actually have an announcement, a webinar to share just while folks chat there. So we have a webinar opportunity coming up in just about a month. It's what can direct care careers do for you? So if you've been following us for a little while, you know we had the Resource and Job Hub as part of an ARPA project that really brought together some resources, some job matching. We really wanted to make it a one-stop shop for folks for direct care careers, for providers, for workers, for interested stakeholders. And so that has been live for quite a while. But more recently, we actually have the Colorado Direct Care Training, which was another ARPA project. So that free direct care worker training is now available on the website. We also have some soft skills modules, say that 3 times fast, soft skills modules that folks can take and engage with, as well as some job shadowing as well. So we just have a lot more stuff happening in 2025 on that website. So we really want to take some dedicated time, a full hour, to really go through that with folks that are interested. So I'm going to drop the registration link in the chat. And that will be recorded as well. But we would love to see you there. Just you've probably seen it in a handful of these meetings, action groups, and the full collaborative, but we've never really taken a full um, chunk of time to walk through that. So we're excited to be able to do that now that everything is live. All right. Any other announcements, questions, wonderings?
Hey, Brooke, I was just going to point out to folks, and I can drop the link, that CDLE has on February 6th from 5:30 to 7 p.m. the Direct Care Worker Rights Training. It's a live webinar. So if folks are interested in attending, they should sign up. I think if they don't get very many signups, they might reschedule. So if there's an interest, go ahead and sign up for it now, just to let you all know about that. And it looks like February 14th from 12 p.m. to 2 p.m. is the next Direct Care Workforce Stabilization Board meeting. And those are open to the public. You'll find that on the same calendar with the same link. You can see how you can find the details for that. So just wanted to put those on everyone's radar.
Perfect. Thank you, Heather. All right. Well, if there's nothing else, look at that. 30 minutes early. What a day. This is great. Let me just drop a few resources for you, give you some few updates. So our next compensation and benefits action group will be Friday, March 21st. That's really important because Direct Care Worker Appreciation Week will be that first full week in April. And so if you're interested in getting a little bit more involved with that, the Value and Awareness Action Group will be meeting next Friday at 1 p.m. to start planning for that a little bit. We have a media kit. We want to talk to folks about, the legislative tribute that we've done in the past, getting folks on the floor and some recognition. So we need to talk through some of that kind of stuff. So we'd love to have you join us for that to do some planning. But then that compensation and benefits will be the last meeting we'll have of this group before Direct Care Worker Appreciation Week. So we'll have a lot of updates for you, hopefully some events we can attend, that kind of stuff. And then the next full collaborative will be Wednesday, March 12th, so a couple weeks before that at 10 a.m. Again, we'll have Get Ahead Colorado there. We have some loose ends to tie up with the survey we presented in December. I'll be presenting on rural sustainability, rural provider sustainability, and what that looks like moving forward. So it'll be a great agenda for that meeting as well. And then just some resources, all of our information, the HICPUF surveys, the state of the workforce, that's all linked there. Direct Care Career Center, the webinar that's coming up. We have our OCL stakeholder engagement calendar, which is a great place to keep track of not just our work, but all the Office of Community Living's work. And then the collaborative website. So I'm just going to drop all those, but I'll put them in notes. These links will make it to you one way or another. So we appreciate you being here and joining us on this Friday. Happy New Year. And we hope to see you again soon. Thank you so much.